The most important problem has been nomenclature. Unfortunately, for more than 150 years, the word angioma has been a synonym of vascular birthmark. And most physicians never realized that under the umbrella of a single word, hemangioma or angioma, different diseases were appearing with different clinical courses, some of them dramatically, even deathly. And that's the problem, the main problem for more than 1 century. It was only in 1982 when John Mulliken and Julia Globacki published the most important paper in the history of plastic surgery, redefining the concept of vascular birthmark and separating basically vascular malformations and vascular tumors. And then in the following 40 years, the International Society for the Study of Vascular Anomalies developed a classification and a new world, a new era in the concept of vascular birthmarks appeared. And now we don't have one single hemangioma, we have like 20 different diseases, most of them clinically very similar, but with a final different outcome depending the different treatment. So nomenclature has been the most important problem for a correct diagnosis and appropriate management on this group of diseases. Since 1975, corticoids has been the gold standard in the management of hemangiomas, but not all of them having the similar response to the therapy. In addition, corticosteroid therapy is a strong treatment full of side effects like hypertension, hypertrichosis, hyperglycemia, and immunosuppression. I have seen many children having strong infections, meningitis, septical episodes in the context of long-term therapy with cortisone. And additionally, many children didn't respond to corticoids. And the second step was vincristine, which is basically a chemotherapy. And we are talking about teeny patients, 3 kilograms, 4 kilograms, newborns sometimes. So the treatment has been not always successful, and children with hepatic hemangioma or upper airway hemangiomas didn't survive to this tumor. So the propranolol, the covert of propranolol in 2008 was really a new door. Basically, many children, 99% of children responding to propranolol are not suffering from upper airway obstruction, from liver failure, or significant scar or disfigurement. So we are now approaching a different disease with always good outcome. No one single child is now at risk of undergoing liver transplantation. It happened in the past quite often, and no one single newborn is at risk now of dying because of hemangioma obstruction in the upper airway. So this is an important sign. Incredibly now, with this 99% rate of success in the treatment of hemangioma, the most important key point is starting the treatment as soon as possible. Hemangiomas can be extremely aggressive in the first 4 weeks of life, and sometimes after diagnosis of a small hemangioma, let's say like un petit pois, like a small thing in the tip of the nose, is not important, and sometimes the child is referred in 4 weeks, 6 weeks for a new visit to the dermatologist, and in single period of 4 weeks we can find the same hemangioma having the size of a cherry and being at indication for surgical removal. So the key point is treating as soon as possible in the first 4 weeks of life, avoiding the potential growth of significant disfiguring hemangioma. Key messages in management of vascular anomalies is basically to keep updated new classifications. This year, last year, 2014, International Society of Vascular Anomalies launched a new classification. It's at the website of the foundation. It's important to keep in mind that many supposed to be hemangiomas are not hemangiomas, are hemangioendotheliomas, are caposiform hemangioendotheliomas, verrucous hemangiomas, different tumors with different outcomes, not responding to propranolol, needing different therapies. So the key point is being updated, study the new classification, go to the proper medical literature, because the misnaming of vascular anomalies is still alive, and then once diagnosed, treat them as soon as possible in order to avoid complications.